we're going to talk just very briefly about vaccinations. When you get your puppy at 6 weeks, they may have already had their first set of vaccinations, but it is important to finish out the series. It is a series of 4 that they get at about 6 weeks, at about 10 weeks, at about 14 weeks, and about 18 weeks, okay? The first 3 sets of vaccinations they get will include a vaccination called DHLP, which includes distemper, hepatitis, leptospirosis, and one other, the P that I can't think of. But and then they will also get a parvo vaccination, which is extremely, if your dog were to get parvo, especially as a puppy, can be deadly. So parvo vaccine and a corona. They will get all of those for the first 3 sets, and then their 4th set they will get all of those. In addition, they will also receive their rabies vaccination and Bordetella, which is a vaccine to help protect against kennel cough. If ever you plan on boarding your puppy, you will need your dog to have Bordetella because it's an extremely contagious disease that is passed through enclosed environments like kennels. If you are worried about over-vaccination, which some people are, because after they've had their series of 4 sets of shots, they need annually to continue getting those vaccinations. Some people feel that that's not necessary, that maybe our dogs are being over-vaccinated. If you're one of those that are worried about that, there is something called a titer test that you can have done on their annual visit. What you would do is go in and the veterinarian would draw some blood and check their levels of immunity to the particular vaccines that to the viruses that they've had vaccines for. If the levels are high enough, they will not need a vaccine for that year. If the level is low, then they will need to have their vaccine. So it can be a more expensive visit for you if you take them in and the titer test shows they need vaccines. Now you've paid for the titer test and the vaccinations themselves. But if you are worried about over-vaccination, that is another option, and more kennels are accepting that, and more places that require vaccinations are accepting titer tests as long as they show that their dog is still immune to those diseases. So make sure your puppy at least gets those first series of shots, the first 4 series, and then beyond that, make your decision if you want to do titers or continue annual vaccinations.